I've been a member of the National Committee's Board of Directors for several years, and I now have the privilege of serving as its chair. The goal of the board and the staff during the past few years has been to increase the prominence and influence of the National Committee on issues related to Social Security and Medicare. And I believe that we've succeeded in developing a more visible and active role for the National Committee in national policy making on these issues. The National Committee has become a respected advocate for strong social insurance programs. Our President and CEO, Barbara Kennelly, has testified before the Ways and Means Subcommittee on Social Security, the Senate Finance Committee, and the Senate Aging Committee, and on lots of other committees. She's briefed the House Democratic Caucus on many occasions and has also briefed the Congressional Blue Dog Caucus, the Congressional Hispanic Caucus, and the Senate Democratic Policy Committee. And in addition, her views on senior issues have been solicited on many occasions by individual members of the House and Senate. She was appointed to serve on the Policy Committee of the 2005 White House Conference on Aging and is currently a member of the Social Security Advisory Board. We believe that Barbara is a wonderful advocate for social insurance programs, and that our Vice President, Max Richmond, and the rest of our staff are also terrific assets for our advocacy on the Hill and with our members. But as effective as we've been as advocates, we decided some time ago that we should add another element to our portfolio. As a consequence, we set in motion a plan to enhance and strengthen our policy and education efforts. We wanted to build our capacity to conduct our own analysis and to share it not only with policymakers, but with the media and citizens across the country. Today, I'm pleased to announce the establishment of the new policy and education arm of the National Committee. It's called the National Committee to Preserve Social Security and Medicare Foundation. You have to take a big breath before you say that. Or you could just call it the National Committee Foundation. In any case, the National Committee Foundation is a 501c3 organization, which is again led by President and CEO Barbara Kennelly. Its executive director is Scott Fry, and its board has as its members Kate Villers, Nancy Altman, Dr. Pat Archibald, Dr. Carol Estes, Dr. Maya Rockymore, Paul Nathanson, Andrew Smith, and me. And I'd like those who are present to stand. Thank you. The purpose of the foundation is to strengthen long-term public support for Social Security and Medicare by demonstrating the critical role that these programs play in the lives of individuals. As you all know, no other federal programs have served so many so well. Despite a strong current of public doubt about the future of Social Security and Medicare, these social insurance programs continue to enjoy overwhelming public support. And the evidence shows that a decent quality of life for virtually all of America's seniors and disabled is and will continue to be tightly tied to strong Social Security and Medicare programs. The simple truth about the importance of these programs is often lost these days in the political and philosophical debate swirling around the notion of entitlement reform. While we understand and appreciate the fiscal challenges that face our country, we think that decisions about cutting expenditures and raising revenues need to be informed by data on the importance of particular programs such as Social Security and Medicare in the lives of individuals. Often cited in the entitlement discussions is the concern for the fiscal burden that current benefit levels might place upon future taxpayers. Yet there are other concerns that also ought to be addressed. How will the aged and disabled fare as private savings and other sources of retirement income fall? Is it possible for today's and tomorrow's workers to achieve the ideal of 70 to 80% replacement in retirement? And will the emerging proposals stem or exacerbate those trends? At the National Committee Foundation, satisfying the public need for answers to these questions is our goal. We're aware that under current law, with no changes, the average Social Security benefits are already declining as a result of the phased-in provisions of the 1983 legislation on retirement age. And we also know that under current health inflation projections, nearly half of the average Social Security benefit may be consumed by Medicare out-of-pocket payments within a decade. Average national personal savings rates and 401k participation rates are dismally inadequate to provide substantial retirement income, and defined benefit plans and employer-provided retiree health care are trending toward extinction. At the Foundation, we want to provide data and analysis that can help to solve problems such as the federal deficit in ways that recognize the needs of groups within the population. The recent study entitled Social Security and Retirement Income Adequacy, requested and funded by the National Committee, marked the beginning of our efforts to publicly examine the broad range of pocketbook realities facing retirees now and in the future. The National Committee has two Foundation reports that we've now put up on our Foundation website: the Gender Gap in Pension Coverage and Progressive Price Indexing in Social Security. And we hope that all of these and our future efforts will help policymakers and the public to understand the challenges of retirement. In closing, let me share a couple more thoughts. Aside from President Franklin Roosevelt himself, perhaps the most significant and constant fixture in Social Security's evolving history was the longest-serving commissioner, Robert M. Ball. Until his recent death at age 93, Commissioner Ball continued to lead the way for a balanced discussion of social insurance through his writings and his interactions with policymakers. We were delighted last November when Commissioner Ball agreed to serve in an advisory capacity to the National Committee Foundation in its inaugural year. We are certainly diminished by his loss, but we're determined to carry on his legacy. We thank you so much for joining us today and for indulging us and our pride and sense of accomplishment as we look backwards over our achievements. But please know that the National Committee to Preserve Social Security and Medicare, and now the National Committee Foundation as well, we're all about the future. Here's to the next 25 years. Thank you very much.